Kidney disease is a significant public health concern in Yobe State, especially in communities around the riverine areas of the state. To curb the menace of this disease, which consumes lives of people on frequent basis, Governor Maimala Buni went to the United Kingdom and made a number of collaborators to identify resources to work with towards ending the rising cases of kidney-related diseases in the state. As part of this mission, the participants here, comprising all categories of health scientists and other community stakeholders, under the supervision of Biomedical Science Research and Training Center (Bio-RTC) of Yobe State University, have been trained on kidney research data collection, built to commence soon in Bade and Damaturu local government areas. Highlighting more on this mission, the Commissioner, Yobe State Ministry of Health and Human Services, Dr. Muhammad Lawangana, represented by the Chief Medical Director, Yobe State University Teaching Hospital, Damaturu, Dr. Babawaru Goni, says, though no documentation on the status of kidney disease in the state, it is predicted that the state is one among the states with the highest burden of the disease.
We don't have a figure, but anecdotally what we see in the hospital is very, very common in those communities. And then, as I alluded to earlier, there are preliminary data that pinpoints to certain communities as hotspots for this problem, particularly along the Komodugu Yobe, beginning from Hadeja, Jama'are, to the River Yobe, which are all tributaries of the Lake Chad. So that's why we're going out there to those communities to find out whether there are some, things that are affecting the kidney, either in form of lifestyle, in form of environmental toxins, in terms of the diets, in terms of the genetics, and so on and so forth.
According to him, this prompts the decision of the state government to embark on the current research. Also commenting, the special advisor to Yobe State Governor on Science Research and Innovation, who doubles as the Director of Biomedical Science Research Training Center (Bio-RTC), Yobe State University, Dr. Mahmoud Bukar Maina says the training is aimed at equipping the participants with the skills of collecting samples that have to do with the environment, soil, and water in order to identify what could be the cause of the disease.
2 years ago, His Excellency and his entourage went to the UK, where they met a number of collaborators to identify resources that would work with us to solve the rising cases of kidney-related deaths, particularly in the Bade Emirate of the state. Following that, His Excellency directed myself to the Biomedical Science Research and Training Center alongside the Honorable Commissioner and the Chief Medical Director of the Yobe State University Teaching Hospital to set up a team with these international collaborators to start addressing this issue.
For YTV News, Muhammad Gambo reporting.